Hello again, welcome again to my channel. And today we're going to be talking about health. And you know, health is wealth, health is everything in the world. And another thing is time. We need time for everything we're gonna do. And with that, we come to what is happening right now in the province of Manitoba. The wait times are crazy, and seems the government doesn't even know what to do and how to go about it. Let's listen to the news and come back on the other side and react to what could actually be the problem.
Good evening. Thanks for joining us. Fixing healthcare was one of Premier Watkinu's hallmark promises during the election campaign. But almost halfway through his mandate, it appears hospital wait times in Winnipeg are not trending in the
During the last election, Premier said, we are going to cut the wait times, we are going to do this, we are going to do that, everything's going to be smooth. But it seems it's not trending in the right direction. What needs to be done?
right direction. New numbers from the Winnipeg Regional Health Authority show they're at times higher now than when the NDP took office. With more, CTV's Jeff Keel joins us now live. Jeff, what is the province saying about these numbers?
See, that's the funny thing. It's even higher than now than when it was before they took office. That's so sad. If you have been in that position, if you have been to the hospital, you know what wait times are and how it affects you psychologically, mentally. It's crazy out there. I've been in that situation not once, not twice, not 3 times, that you have to wait and I don't know.
Manitoba's health minister says they have added hundreds of doctors and nurses, but they know more needs to be done. They're committed to it, but says this will take time.
See, that's the problem with positions. They've added this, they've added more doctors. That doesn't do anything. In a province of millions, say you're adding 200 doctors, adding this, adding that. It needs to be broken down and looked at. This is not the time for passing the blame. This is not the time to say, oh, there has been some cuts in the previous government. You promised you did, and that's why you were voted in. This is no time to let some excuse.
The nurses union says the time for action is now.
Rebecca James and Pavel White are sleep deprived.
I haven't slept. We haven't slept.
That's because they say they just spent 20 hours waiting in the St. Boniface Emergency Department as James was battling a blood infection.
If you have never been in this situation, you think it's a lie. Waiting 20 hours. There was a night I went to be with someone at the hospital. I got there around 11, and this person said he has been there since around 9. I left the hospital around 9 a.m. Still, he hasn't been attended to. He hasn't seen the doctor. If your blood BP checked, well, whatever things done by the trial nurse doesn't count. Seeing the doctor is the most important thing because that's why you are there. People are still waiting and waiting for hours. If it means building new hospitals, if it means restricting people to a certain area so that the wait times could be reduced and people will be able to see a doctor because it needs to be spread. If you are from Transcona, stay in this Transcona catchment area and more hospital needs to be built. I remember since they said they are going to open the emergency hospitals, wherever, everything, all hands should be on deck and whatever needs to be open should be open. This is no time to pass the blame. This is not time to shift blames. Something has to be done.
Oh my God, exhausting and staying on the chair. I really hated it. And yeah, it was just really awful.
They're not the only ones waiting. The latest numbers from the Winnipeg Regional Health Authority show the median wait time in Winnipeg in December 2023.
I see all these numbers, all these media numbers, waiting time, all this are just psychology, playing with your faculty, because How can you tell me after spending 20 hours, after spending 10 hours, after spending 8 hours in the hospital and still nothing is done? And tell me all this 4 hours wait time in 2023 median. I don't buy all that. Something has to be done so that you need a doctor, you are going to see a doctor. That's what needs to be done. Something has to be done. There's no two ways about it. And how it should be done, that's what we want to hear. Forget all these statistics and let's make a plan on how to reduce all this wait time.
Was 4 hours, an annual high. In February, a peak for the year so far of 3.97 hours. The times dipped down, only to go back up to 3.65 hours in July. All of these numbers are higher than August 2023, which was 3.23 hours 2 months before the NDP took office.
What we're hearing from both our nurses and from the public, wait times are increasing in our ERs and urgent care. So, yeah, we're definitely not going in the right direction.
Premier Wob.
That's the summary of the whole thing. Things are not trending in the right direction. And something has to be done. What are we going to do? That's the simple question. What needs to be done? It's as simple as that. Just imagine this wait time.
The NDP government promised to fix healthcare during the election campaign 2 years ago. Manitoba's health minister says since taking office, they've added more hospital beds, 900 net new nurses, 200 doctors, and hundreds of other healthcare workers, as well as primary and minor injury clinics. Plus, they say more initiatives and hires are on the way.
What we need is a long-term, sustainable trend in the right direction, a meaningful change. That does take time, but we're going to continue doing the work so Manitoba to see that happen.
The minister says other provinces are facing similar challenges.
That's not what I want to hear. I'm in Manitoba and I want to hear everything about Manitoba. Forget other provinces. That's their own problem. They should deal with it themselves. What needs to be done in Manitoba? Because that's what the politicians do. Oh, it happens in Scotia, Nova Scotia. It happens in BC. It happens in Ontario. That's none of my business. What needs to be done in Manitoba to reduce those wait times? How are you going to go about it? That's all I care to know.
Calling this a complex problem that will take time to mend.
The reality is we're dealing with the consequences of years of massive closure.
See, we are dealing with closures that have happened years ago. You promised to fix it, and that's why you were voted in. Forget about what happened a few years ago. How are you going to tackle it? We already know it's been bad. Try and do something about it. That's all we care to know.
And cuts to emergency rooms.
I think that the time for playing the blame game and blaming the previous government has to stop.
Yeah, she said it. Blame game time is over. Blame the previous government is over. We don't care about that. What needs to be done, that's what is right in front of us. And that's what we care about.
The numbers from the Winnipeg Regional Health Authority already showed that the median wait times for all hospitals in Winnipeg went up from 3.42 in July 2024 to that 3.65 number in July of this year.
So, Manitoba government, health, put your heads together. If it involves a forum, let's talk about this. More hospitals needs to be built, more doctors, more health workers, whether primary, secondary, and tertiary health hospitals needs to be built more because the population of Manitoba as of today is quite different from what it was 10 years ago, 15 years ago. And there should be a plan moving forward, a plan for 10 million Manitobans because the province keeps growing every day and there should be a plan, a long-term plan that needs to be done. So what's your opinion? What do you think needs to be done? Because it's getting crazy. If you have any suggestions, idea, let me know in the comment section. And if you love this video, if it's your first time seeing my face, please don't forget to subscribe for more videos like this. Thank you. See you on the next one.